Hi, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. On this episode, I'm talking with He Stewart. She is a leading childbirth educator, advocate, and maternity care reform expert. Today, we are talking about how doulas integrate themselves in the healthcare system to improve outcomes for moms, parents, and babies, and what type of benefits somebody might see when hiring a doula, how important they can be, and how they can help somebody through the pregnancy, birth, or postpartum experience. He has a master's in human development and over a decade of experience. She empowers families with evidence-based birth prep, informed decision making, and postpartum readiness. She's a fierce advocate for informed consent, reducing unnecessary interventions, and ensuring patient autonomy in birth. She's actively involved in legislative efforts to improve women's health policies and expand access to midwifery care. She works to reform maternity care by advocating for patients' rights, increased birth options, and improved maternal health outcomes. As the host of the Birth Lounge podcast, she interviews leading experts in pregnancy, women's health, and newborn development, giving parents the knowledge they need to navigate birth and postpartum with confidence. Now, let's dive in and meet Hihi. Welcome, Hihi. Thank you so much for being here.
Thanks for having me. I'm super stoked for this conversation.
Me too. I've been watching you on Instagram and social media and seeing your work and actually seeing quite a lot of growth in your page and really blossom and you doing super cool stuff. So we're going to get into all of that today and how supportive doulas can be in the perinatal periods. It's a great combo and people understand that doulas are available, but some people still don't even have full information or full awareness of what a doula is and how they support. So we'll get into all of that.
Thank you.
So I'd love to start with understanding how you got into this work. I love stories of how people find their way.
Yeah, absolutely. So my career started in the early childhood sector. I have a master's degree in human development and family studies. And while I was getting my master's degree, I worked in an early childhood development center. And I fell in love with early childhood. And I thought, wow, this is where I'm going to be. And while I was getting my master's, I also was helping children on the autism spectrum and particularly helping their families navigate the public school system
Oh, yeah.
and getting support services for their children. And that was my first light taste of advocacy work. And I got to see how impactful it was. And I also got to see how broken the system
Yeah,
was, right? At
sure.
that point, I was
Yep.
obviously working for the public school system, but a system nonetheless. And then that was in the state of Alabama. Then I moved up to Massachusetts and Boston. And I was in early childhood again. And during my years in early childhood, my first couple years here in Boston, someone has suggested that I become a doula. And I didn't really know what a doula was.
Mm-hmm.
So the more I looked into it, I realized, oh, okay, it's very similar to what I have been doing, except it is birth work and it can incorporate that advocacy piece, which I missed since moving from Alabama. It incorporated all of my knowledge and my master's degree in early childhood and that lifespan. And while I was in the classroom of early childhood, I was in the infant classroom for a couple of years, and I actually realized that parents have so much anguish coming to drop their children off at the
Right.
first day of childcare,
Yep.
and a piece of them were excited to get back to normalcy. A piece of them was pretty scared
Mm.
because they were dropping their children off for the first time with
Yep.
seemingly strangers. Of course, we're licensed. Of course,
Yep.
this is a
Right.
reputable center, but they don't know me. We
Right.
had met
Right.
maybe once before. And there was just a lot of fear and anxiety. And I started to look into how can I help resolve this for these parents? And I actually realized when I'm in the classroom, I'm getting them way too downstream. If I
Mm.
really want to help people be confident in their parenting, it
Mm.
actually has to start much more upstream
Mm.
pre-pregnancy and specifically in that pregnancy period. And so I trained as a doula, and the training that I took 10 years ago was just a weekend course. And so to partner that with my master's degree, it felt so full circle. And that's how it was. I got my first client within a month of my training, and she was like, this changed my life. She had a previous traumatic birth. We
Mm.
went on to have the second birth with her, and it was not traumatic at all. And she was
Mm.
like, you have got
Fantastic.
something so special here. And that was the diving off point, and it has just been 100 miles an hour since then.
Right.
For me, it truly is a calling. It really is. I've gotten to see the doula-ship
Mm,
in many different facets, and I feel very blessed to be able to do this work, but
mm.
also really aligned. There's not a day that I don't wake up and I'm excited. I'm not excited to get to do this work. I wake up every single day and I'm like, all right, how are we going to take on the system today? Okay. How are we going to empower women today? All right. How are we going to avoid birth trauma today? And so that's how I got my start.
That's awesome. I love that. And yeah, I can tell just from seeing you on socials and stuff how passionate you are about
Thank you.
this. That comes through very clearly, which is great, which is why people come to you and learn from you. And I assume have trust and safety with the work that you're doing.
I don't know.
And that's so needed during this period of time. Like the perinatal period is so vulnerable and there's so many unknowns, and a lot of people go through it alone and not having the support that they need. And even when I'm have a meeting with somebody who's pregnant and maybe dealing with anxiety, and I suggest a doula for birth or postpartum, sometimes they know what that is and sometimes they don't. So just for our purposes today, would you be able to walk through what a birth doula is, what a postpartum doula is, and what kinds of things that you support people with?
Of course, they are exactly as they seem. A birth doula is going to focus primarily on the birthing process. So, this doula is going to provide childbirth education and prenatal care. Now, not medical prenatal care. All
Mm,
doulas are non-medical providers. I always say that I don't have patients, I have clients
mm,
because I am not a medical provider in any way. No
right,
doula is. They may have additional training like being an RN or being a
uh,
midwife, but they won't be practicing in that capacity when they are your doula.
got
So
it.
your birth doula, typically they attend your labor. This could be physically or virtually.
Mm,
And they also may have additional trainings and offerings that do coincide or overlap with postpartum. So you may find that your birth doula also is a lactation counselor
sure,
or
right.
also has baby wearing experience, or also knows about baby sleep, stuff like that. So there is often some overlap, and you're going to find doulas that like my business, we offer full spectrum care. So we're with you from the very beginning of your pregnancy throughout your entire pregnancy. We
Mm,
attend your labor. We have both physical and virtual services. And then we also follow our clients for the first year postpartum. So we're full spectrum. Not
that's
all doulas
amazing.
are going to offer that. Thank you very much.
Yeah.
I think that it's a very specific type of client that wants that high
Yes.
touch hands-on
Yep.
experience, right? Doulas offer different offerings as well. So some birth doulas are going to offer one or two prenatals, all the way up to many. My company offers 10. So everyone who births with us, we have 10 prenatals with you, and it allows us to get all of your comprehensive childbirth education
Mm,
done and
mm,
completed. Then you have postpartum doulas, and again, these may be doulas who do go to births, but they also just may be like freestanding postpartum doulas. They're going to be a lot focused on helping you heal in
mm,
postpartum,
mm,
helping you find your footing, getting you settled into your new role as a parent. And
right.
that may come across as a doula is only good for your first baby, but that is so far from the truth.
Right.
Every single child you introduce to your family dynamics are going to change a little bit because you've got a new human being
Totally.
introduced to that dynamic, right? And
Yep.
so you are learning how to be a mom for the second time while already having a first time child. You're learning to be a mom for five children
Right.
instead of four children.
Right.
And your partner, same thing. They're
Yep.
learning now how to support you in a larger family. And so postpartum doulas can offer daytime support where they come
Mm,
in and help you with feeding, routines, mental health, not in the capacity of a counselor, but helping to identify when issues come up, identify this is hard and normal versus,
mhm,
you know what? This is not so normal. And maybe we
right.
do want to get you to a counselor. Maybe we do want to talk to your OBGYN about this. Maybe you should reach out to XYZ professional. Postpartum doulas also may offer overnight care, sleep support, or baby wearing, stuff like that. And the spectrum is wide, which is wonderful. It means that you get to find the flavor that fits you and suits your family best, which I love so much.
Absolutely. That is amazing. So, what I love about any way that somebody can have a doula in their care, I think is so important and so unique in terms of the support that somebody can get during this time. You go to an OB and the OB or whatever, if you have midwife, but even midwives meet more regularly. But if, let's say you have an OB and you meet every so often, they are tracking you. They do know you to a certain extent, but there's this certain, I don't know if the word is like intimacy or closeness maybe that
Yeah.
is different with a doula. they're they're having longer conversations with you, they're in your home potentially, and they're seeing you in more parts of your life or in deeper ways than other providers might. It's, I would think, a little bit easier for a doula to pick up on, hey, maybe there's, I wonder about anxiety or I wonder about depression in that scenario. It's just, it seems easier to be able to support somebody to spot it and potentially help them get to support.
Yeah, I think you're right. So I think there are two prongs to this. So yes, we meet with people longer and our relationship is a little bit more intimate, but we're also meeting with you in your turf. It is so important for us to get together in your home because we actually get to see the inner workings of your life. Whereas when you're in a medical setting, you're on your doctor's turf. So most people dress a little nicer than they
Mm-hmm.
typically would. You're not going in your sweats, which of course you can. No one's
Right,
judging you.
right,
But
right.
most people feel obligated to like at least put on something a little nicer. And you're going to sit prim and proper. And you're only probably going to speak when your doctor asks you questions. Not a lot of people are going to feel confident enough to speak up, although that is what I teach you in the birth lounge. I'm teaching you how to assert yourself in those
Right.
situations, right? That there is just this air about a medical setting that we've all been taught
Mm,
to perform and act and behave a certain way, where when your doula comes over, especially postpartum, you're likely naked. You
mm,
might have a robe on. Your boobs are probably out. You have a baby that is attached to one of them, but I'm seeing your naked breasts on the other side. You're in a diaper matching your newborn baby. You're
mm,
bleeding from just having your baby. And postpartum or in pregnancy, you probably have boxes everywhere because all of your baby gear is
mm,
getting delivered. And you may or may not have been able to do the dishes before I arrived.
mm,
And if you didn't put up your dogs by the time I got there, they're probably
mm,
running awry all over your house. I don't mind. I love
mm,
seeing this part of people's
mm,
lives. It helps me
right.
understand who you are as a human. How does your house interact? Remember that master's in human development and family studies, a deep part of that was understanding human interaction and what
Mm,
makes us tick as humans. And
right.
so I love seeing people in their homes, but I do think it is a really special, informative part of the relationship that your medical professional is not going to have insight to. And, when a medical professional walks into your birth, if they've met you before, they've spent increments of 10 minutes with you.
Mm,
Whereas I know you. I might even know your parents
mm,
if they came to one of your prenatals
sure.
or if they were at your home when we met. I have probably heard you cry at
Mm,
this point.
mm,
Something has probably bothered you by the time that we've gotten to labor enough to bring you to tears.
right.
You may have shared troubles with your partner or
Mm,
struggles that you guys are facing in pregnancy. If you struggled or had challenges to get pregnant, I know that about you much more than just reading it in your chart. We've
mm,
probably had an in-depth conversation, if not numerous in-depth
mm,
conversations. I know your dog's name. I
mm,
know the community that you live in. I
mm,
know what you do for work. I know your anxieties and your fears. I know
mm,
your goals deeper than just scanning a birth plan. And
mm,
so I think there's two parts to that as well. That gives that birthing mom, person, partner, family so much comfort knowing I've got a cheerleader that
mm,
knows me in and out. I've got someone who's going to advocate for me, and I have somebody that if things get intense, i.e., they will, because birth always does, it doesn't mean it's bad, but
mm,
birth is intense. I can turn to he or my doula and they will know me. They know who I am. They
right.
know what I want, my preferences, my goals, my wishes, my desires.
Sure. Yeah.
For the medical professionals, that sometimes is really lost on them. They have a hard time remembering that I don't have the same relationship with this person that they do. I'm not a
Mm-hmm.
stranger. I know
Mm-hmm.
this person very intimately and
Oh, you
deeply.
mean if
So,
you are in the room, the medical professionals might not realize the depth
yeah,
of your connection?
absolutely.
Oh, okay. Yeah.
Absolutely. And I actually think a lot of them forget that. And I think once you remind them of that, because I have this ritual when I walk into a room, a birth room, most of the time our clients are already at the hospital and
Mm-hmm.
kind of established when I meet them,
Right.
unless we have transitioned later in labor and we arrive at the hospital at 8, 9, 10 centimeters and we're
Mm-hmm.
just ready to push out a baby. It really depends on that person's goals and how they'd like their birth to go. But if I don't arrive at the hospital with you, then I'm coming into an established labor and delivery room. And so my ritual is to set down my bag. I like carry a backpack. So I set down my bag, I wash my hands, and then I introduce myself to the medical providers in the room. And I'll say, "Hi, I'm their doula. I've been working with them for 7.5 months. So if you
Mm-hmm.
ever need anything or you ever have questions, or I'm just here to help. So please use me at your discretion. I want you to know we're on the same team. I love them. They are so smart and educated and so well prepared today. And we've been working so hard to help them have a great birth. And we're really excited for you to be part of this. And I'm so excited to get to work with you today. I just wanted to introduce myself and let you know that I'm here to help. Thank you so much." And most of the time, that's really well received by medical staff, but it also gives them that little reminder like, oh, she really knows this couple. She's been working with them for 7.5
Mm-hmm.
months. All right.
Mm-hmm.
And through our banter during the L&D room, you'll get to know that. They'll ask about my husband and they'll ask about things that are going on in my life. And I'll ask
Sure.
them about intimate things that are going on in their life. And the nurses and doctors often realize, oh, these people have a true relationship. And sometimes, oftentimes, we get asked, are you guys like friends? Oh, is she like your sister? And I'm like, no, but she could be. Like, I know her that well.
Right.
Like, we could be friends. And I guess high level, we're friends. But no, I'm just her doula. I just know her very
Mm-hmm.
intimately, and I care
Mm-hmm.
very deeply that she gets the birth that she desires. And that definitely is portrayed in the birth room very clearly.
Yeah, and for all of the reasons you mentioned, that in from just like a psychological perspective, it's so protective for mental health and for wellness. When it doesn't mean to say it will prevent anything from happening, but in some
Totally.
ways it's preventative and protective. You have somebody who knows you, you have and somebody who could speak for you or advocate for you if needed, as needed. And the again, like going back to this real feeling of vulnerability during pregnancy, especially during birth and especially during postpartum, that a lot of the things that I hear from people when they are dealing with things like birth related trauma or mental health challenges, not everybody, but a lot of people have felt alone in some way or another. And there are many ways that people can feel alone. However, just having a crew, having people, even if it's only one person that knows you, that is there for you, that can advocate for you, that can notice changes if and as they come, is so important. So important because if somebody is feeling anxious or worried, I'm not talking about like clinical diagnosis anxiety, I'm just feeling anxious and they know that they have you as a resource right there or somebody to support them, that brings the intensity down, that brings the level of concern and worry down. And all of those touch points, anytime that somebody can feel supported and heard and validated, that's preventative, that's protective of their mental health.
Yeah, we know that having a doula at your birth and postpartum has so much benefit. So, birth in particular, you have less risk of birth trauma. You
Mm-hmm.
have less risk of needing an assisted birth, like forceps and vacuums. You have less need for pain relief. You have less C-sections. Those people have less induction. So, all of the things that most people are hoping to avoid, a doula can help reduce those risks. In postpartum, there are a lot of benefits in terms of they have less rates of postpartum anxiety and depression. They have higher rates of breastfeeding. They usually report higher satisfaction and happier postpartum periods. And
Mm-hmm.
so having that person beside you even like you said, even if it's just one person, it gives you this confidant that can let you know this is really hard, but you're doing a great job. And if it gets too hard, let me know. I can come over. I can bring food. I have a Rolodex of professionals that I can connect you with. I have tips and tricks up my sleeves that you may not know about because this is your
Mhm,
first baby and I've been doing
mhm,
this for 10 years. I can
mhm,
help make this easier for you. And I think that's really important in a country that unfortunately we don't have the infrastructure to properly support moms
right,
and parents and families
right,
in pregnancy and postpartum, but particularly in the mental health piece of both of those places. It's our medical community is very focused on medicine. It's the
mhm,
medical aspect of things, whereas, like you said, I can notice when someone looks uncomfortable. And so their doctor may think, like, all right, this is just who they are. I've never met them before. I'm just the doctor on
sure.
call. And I can say, hey, Angela, you look a little uncomfortable. Do you have questions for Dr. Jones?
Mhm,
Hey, Mary, you look like you are not wanting to actually go forth with this procedure. Did you have questions before we
mhm,
actually move forward? You are welcome to stop the conversation and ask
right.
your questions before we keep going. And so, as a doula, and every doula works a little different. Every doula has their own approach and philosophy, but my job is never to speak for someone. Rather, I pause the room and open up space for you to speak for yourself. And I
Mhm,
give you that permission to do. I just
mhm,
simply pause the room and say, I'm noticing this. Do you want to X, Y, and Z? Do you want to say no? Do you want to ask more questions? Do you want to
mhm,
take some time to think about it? Do you
right.
want to ask about alternatives?
Yeah.
Which I think is really helpful because in the moment, it can not only sometimes feel as if the way that it's being presented that we don't have that right, we
Mhm, mhm,
can't do that.
mhm,
But I think sometimes that fear takes over and we forget, oh, yeah, I can ask questions. Oh, yeah, I
oh, for
have the right
sure.
to say no. But it just feels very intense. And so sometimes we just go with the flow or we go with what we're being told because we forget that we can do things
Right.
differently.
Absolutely. As you were talking through that memory of my own birth, this was 15 years ago with my first. I had a doula at for both of my births. I had a birth doula, and there was like a shift change. It was in the middle of the night shift change, and the OB that I had before and the nurses that I had were super supportive, and like they were letting me do my thing. It was a very long labor. It was back labor too.
Ugh.
And then so shift change came in, and this OB walked in and was like, "You've been doing this for too long. You need to think about these." It just came in firing off all of these things that I needed to do. And I was in like such a state already from being in labor for so long, like almost like in a bit of a trance, like a positive trance, not a
Mhm.
bad one, of that I was not able to vocalize any of my what I needed or but and as she that OB came in and was saying these things, I had these could feel these like feelings of fear pop in. And my doula knew the birth plan, my husband knew the birth plan, and so this OB came in, said all of these things and left. There was no conversation. And doula went out, husband went out and had a conversation with this OB. And the OB came back and apologized to me. It was like
Nice.
amazing. Yeah. Yeah, it was great. Thanks for that memory. That was cool.
Isn't it funny how your birth stays with you? You mentioned that was
Yeah.
15 years ago. I often have people write in on my Instagram or we get emails or I have an app. It's called the Birth Lounge app. And we have people that have had babies years ago that will write in and sometimes say, I had my first baby 43 years ago and this reminds me of how I was treated. And sometimes it's really good and
Mm-hmm.
sometimes it's not so good. And
Right.
I think that's the lesson for any medical provider is that person that you're taking care of will never forget how you made them feel.
Oh,
They
yeah.
might not remember your name and they may not remember
I
your hair
definitely
color
don't.
or the scrubs that you were wearing, but they will never forget how you
Yep.
made them feel.
Oh, for
And I think
sure.
that's really powerful. And I think that's lost on a lot of medical providers. And it can feel like just another Wednesday in the
Mm-hmm.
office for your OB or midwife or nurse or anesthesiologist. But it's really important to remember this is a really pivotal day for this person. It is a
Yeah.
changing of the guards in their
Oh, yeah.
life. They will
Yep.
never be the same person that they
Yep.
were when they walked in these doors as when they walk out.
Yeah, for sure. And the benefit of having the continuity of the doula and that kind of support is that, like, even with the example that I just gave, I had the first OB and I think I went through 3 or 4 shift changes there.
Yep.
So I was there for a minute.
Long labor.
It was like 36 hours. It was long.
Wow.
The temperature in the room, the feeling in the room changed with different providers. Some of them were amazing. And one of the nurses that I had was just phenomenal. And she made all of the difference. I definitely remember her. I don't remember her name, just like you
Yep.
said. But my doula being there, being the continuity and like being the constant with both her and my husband, being the constants there, like those things changing in the room it happened, yes, and they shifted things a little bit, but I had that to rely on. And that was same was true for my second birth, which was very different from my first one. But same doula. She knew and we didn't it was amazing for her to just be able to drop in like that.
Yeah. I think people always think, I've already done this once, so it'll probably be the same. And I love that you highlight no two births are the same.
Oh no.
I also think a lot of people think, okay, I might have had a C-section my first birth, but I'll probably have a vaginal delivery this first and this second birth. And if I had a vaginal delivery my first birth, then I'm almost guaranteed to have a vaginal delivery my second birth. And obviously the rates are high. If you have already achieved a vaginal delivery, yes, you are almost very likely to have a vaginal delivery, but not always. And so
Hmm.
there will always be these unpredictable moments in labor. And I do think it's really important to have somebody there that knows you very intimately. And I will caution people to say, like, that would be my husband, or that would be my partner, or that would be my spouse. Your spouse is playing a role.
Hmm.
It's your spouse.
They need support too.
Totally. They are playing, if you're
Yeah.
in a heterosexual relationship, they're playing the dad of your baby. That is their role. They are
Hmm.
playing your husband. That is
Hmm.
their role.
Hmm.
To ask them to play the doula, sometimes it works. If your partner knows that's the role that you are asking them to play and they feel equipped to do it. But to assume they can also be my doula, they can play that role. For me, I think without a very explicit conversation about expectation and whether they feel equipped and okay taking that on, it's almost doing them a disservice. I'm
Yeah.
planning to have my first baby. I'm pregnant right now. We're almost halfway through. And a lot of people want to know, will I have a doula? And the answer is yes, absolutely.
Hmm.
And they're like, I'm so surprised by that. You know so much. And I'm like, yeah, but I don't want to be my doula. I want to be mom. And
Yeah.
I'm married to an EMT, but I don't want him to have to be an EMT. I want him to
Hmm.
be able to be dad. I want him to
Yeah.
be my husband. I am
Hmm.
absolutely going to have a doula because I know how beneficial it is. I
Hmm.
want a doula there because I want to be able to play my role and I want him to be able to play
Yeah.
his role. And we get to wear these special hats that only
Hmm.
we can wear. And
Hmm.
I want my doula to be able to be a doula. And so,
Hmm.
yeah, I think your partner can be a doula if they're okay with it and they feel equipped and you've had that talk, but please don't assume that they can and will do that
Hmm.
because they are already playing a role.
That's a really important point. What do you do if, kind of shifting a little bit, what do you do if you do notice that somebody is like struggling or they seem more anxious or more down than you're used to them being? How do you manage that?
Are we talking in pregnancy or postpartum? Because they're different.
Oh, yeah, that is true. Let's talk postpartum.
Yeah, so postpartum, you've got that period of time where it is quite normal to have the baby blues. You are transitioning to your new role. There's going to be a lot of really intense feelings. We're keeping really close eye on them. And this is not specific to people who are just feeling down. For our team, we pretty much talk to our people every single day in the first 2 to 4 weeks. It happens very naturally and organically. We're helping with lactation, we're helping with body healing, we're helping with infant sleep, we're
Hmm.
helping with all the debrief in their birth. So as you get further and further out from your baby, if you've never had a baby before, each day new memories will pop up, and each day things will come to your brain and your memory, and you'll say, oh, did this happen? Or, oh my
Hmm.
gosh, I just remembered this about my birth. And we're there to
Hmm.
debrief that and process that with them.
Great. That's so
It,
important. That's so
yeah, it
important.
really is. And it's so helpful to have that. And I think if the US had a better infrastructure person would be able to benefit from this. But if we notice that during that postpartum kind of baby blues period, things are deeper than what is expected or what is typical, we'll bring it up to that person and we'll just let them know. Most of our clients have mental health professionals because we're very pro mental health support in pregnancy. At the very first sign of anything, we always are saying, why don't you get a counselor? Why don't you talk to somebody? Why don't you join a new moms group of prenatal women? And so we do a really great job of connecting people to their community in one way or another. But same thing in postpartum. If they are struggling beyond what is traditionally expected, then we'll bring it up very quickly, the very first sign. Usually people already have meetings on the calendar with their mental health counselor, but if they don't, we will encourage them to get one. If it's a little bit further out, we'll encourage them to move it up or to add an additional one. Not everyone is as self-aware or as open to hearing these
Right.
things.
Sure.
We have spoken about this in it prenatally in your pregnancy.
Yeah.
So now we're now transitioning to pivot to follow that plan. Who did you want us to tell? Did you want us to call your mom? Did you
Mm,
want us to come in person and sit you down and explain to you what we're seeing? Did you want us to reach out to your partner? That's usually what people want. They'll say,
sure.
look, I'm a little resistant because here's how we do it. In your prenatals, we'll talk about this stuff and we'll say, like, all right, we don't expect anything out of the ordinary, but let's just say we run into some problems and we're noticing that you are feeling a little sad or you've got some anxiety that
Mm,
is a little untraditional.
mhm,
And how would you like us to tell you that? And they'll tell us, and we'll say, okay. And if that doesn't work, or if we're not able to get you to see what we're seeing, who would be the top 2 to 3 people that you would like us to go to maybe see if they're seeing what we're seeing? And typically it's just call my partner or my best friend or my mom, or,
mm,
and some people say my OB, my therapist. And so our team is not new to having the numbers of people's therapists and OBGYNs. And of course, there's paperwork to make sure that we can
yeah.
talk to one another, and we get that done prenatally. But I've spoken to many a therapist. I've spoken to many a OBs or midwives and said, look, I'm a little worried about Dr. Kat. She's got this going on. I didn't notice it prenatally. We've been tracking her for the last 3 weeks. I would have expected by now for these type of things to have
Mhm,
lifted.
mhm.
It's not really lifting. Have you had a chance to speak with her? And or I know you had a meeting at 6 weeks. I was actually wondering if you might want to reach out to her and see if you might want to just connect with her a little bit sooner. And most people are very open to it in
Yeah.
terms of, oh, I have been feeling that stuff. I didn't realize it was a problem. But like I say, every now and then you get a mom or a birthing person who just says, I really don't think I'm struggling that much. And on the outside, it's very apparent, sister, you're struggling.
That's true.
And there's that is so normal, and it does not mean you're a bad mom. It's not
Right.
indicative of your parenting skills or your
No.
capability to love your baby. It just means that hormones are hard and they're
Yeah.
reckless and they come in and they just sometimes they wreak havoc on us. And
Sure. And
luckily we
yeah.
have a community that can help.
Yeah. That's really important. And I love that kind of safety net is built in there. Ugh, I wish everybody could have that.
Me
It,
too.
it would change so many things for people.
Hmm. And talk
That's great.
about, oh, sorry.
Oh,
Sorry
go
to
ahead.
cut you off, but I often talk about we think a lot of maternal health legislation and fixing the system comes from just having more prenatal visits or having more postpartum visits. But at the crux of pretty much everything, it's mental health. If we could fix mental health, if we could get to people prenatally and help them get stable in pregnancy, and then if we could stop traumatizing people in birth
Yeah.
iatrogenic, meaning that
Right.
it's a trauma that didn't need to happen.
Right.
If we could stop making people feel alone and out of control in the choices that were made about them, not by them, but about them
Mm-hmm.
in labor, if we could get the community to rally around pregnant people, we would see so much less maternal death, suicide. We would
Mm-hmm.
see so much less mental health in kids. We would see better parent-child bonding. We would see longer-term health benefits. Our
Mhm.
breastfeeding rates would go up. I firmly believe our divorce rate would drop. I just think
Yes.
there's so many benefits that we miss the point and we think, oh, let's just get childcare paid for. And I do think that's a great thing. I think that's
Yes.
a large part of it.
It takes a lot of different
Totally.
things. Yeah.
But what if we had healthy moms and dads and parents to begin with?
Mm.
That would be actually, for me, the
Yeah.
most pivotal part, in my opinion.
Yeah, I agree with you. And for all the people that I've talked to across the, not spectrum, but everyone basically that touches somebody who's pregnant or postpartum really can see, if they've been working in the field for a little bit, even can see how important this period of time is, how formative this period of time is, how life changing it can be, both for the birthing person, but the family and the kids. It's like the root, it's the beginning, if you will, of making sure that people can have the birth that they want to have, can stay healthy both physically and mentally. Yeah, our infrastructure, of course, isn't there all
Yeah.
the way yet. But that's why you do what you do, and that's why I do what I do. We're trying to fix it.
Move that needle just a little.
Yeah, and it is moving.
Yeah,
It
oh,
is
of
moving.
course.
Even from when, like 15 years ago, when I had my doula to now, there's people know way more now that doulas are even a thing and how supportive they can be and are. People understand more about perinatal mental health conditions and that what they are and that they can get help. And there's just still so far to go.
Yeah, we do have a far way to go, but I agree with you. I think the needle's definitely being moved. Things are getting better, not necessarily from a legislative standpoint. I don't know how much our nation is doing for us, but moms are waking up. Moms are
Yes.
starting to band together. Moms are starting to demand better. And we are seeing companies, smaller companies or like individual companies start to write in better mat leave policies
Yes.
and start
Yes.
to have, instead of just maternity leave, it's parental leave. And it doesn't
Hmm.
matter where you are in that,
Right.
whether you're the carrying parent or the not carrying parent, you will get parental leave. And
Or if you're
you
adopting, if you like all
exactly.
everything across the.
Even recently, miscarriage leave, which is
Yes.
so important. There's just so much that could be fixed in our infrastructure.
Hmm.
And while it's
Hmm.
not happening at a national level, we are seeing it at that micro level. And I
Yeah.
do think that's going to get the momentum going and going. And then eventually we'll see it on a national level, which obviously is
Yeah.
ideal.
Yeah.
Yeah,
Yeah.
fingers
Fingers
crossed.
crossed for until. Not holding my breath. I'm going to take some deep breaths and
Yeah.
keep my fingers crossed and keep doing the work. With all of that, we talked about so many things, but what else do you really want people to know?
Yeah, I think my lasting message for people is you don't need permission. You don't need a doula or need your mental health counselor or need your partner to tell you or to give you permission to go ask for help.
Mm.
If you feel like you're struggling, if you feel like you have challenges, if you feel like something is missing, I need support. You have every right to ask for support. And we've already said it, but it's not indicative of your ability to be a parent or the child. I might be in the minority here, but I view asking for help as a strength
Mm.
because I think so many of us are conditioned to just do it on our own.
Right.
It's the American culture. It's very much how kind of women have been conditioned. It's how the motherhood sector has gone. But you don't need permission to ask for help. Just
Right.
ask for help. Just say, I'm struggling here. Go back to your OBGYN, call your mental health counselor, hire a doula, go to your partner and say, hey, this has been a really hard transition for me, and I'm
Mm.
struggling in these areas. I'd like to talk about how we can make our household work a little bit better. Or I would like to talk about how at the end of your day, I know you're so tired, but if you could do these one or two things for me every evening, wash the bottle and pump parts, make sure the dishwasher is empty by the time you leave for work the next day. If you could just help me swap the clothes over from the washer to the dryer, that would relieve so much of my mental load. You don't need permission to advocate for yourself, and you are worth it. You are worthy of having
Yep.
help to make your life easier. You are carrying the whole load of your family. And so to ask the people around you, your community to support you, you deserve that.
Absolutely. Yeah, I hope people hear that and really take that in. It's
Yeah.
super, super important. And yeah, that's also protective of mental health for sure.
Yeah, absolutely.
I thank you so much for coming on, for all the work that you're doing, for walking us through all of the ways that, or we didn't even touch on all the ways, but all the ways that doulas can be supportive and helpful. I think this is crucial information for people to have in order to support their process and their mental health and their well-being.
Thank you so much for having me. I've really enjoyed my time here.
You can find more about Hihi and her work at thebirthlounge.com or Tranquility by Hihi, the Birth Lounge app found in Apple App Store and Google Play, or at the Birth Lounge or at Tranquility by Hihi. And all of those links will be available in the show notes for this episode. And do share this far and wide. Send this episode along to somebody who might be considering a doula or might not even know that doulas are available for support. And thank you so much for joining us in this conversation today. Until next time.